Good evening, ladies and gentlemen. I'm Katyayani, your host for today. I welcome you all to yet another episode of our ongoing series of discussions on arthritis in India to mark Bone and Joint Health Awareness Month. We would also like to thank Pfizer India for helping us put this together. I welcome you all to the Gujarat chapter of this series today. So, I would first go on and introduce all our distinguished panelists. We have with us Dr. Amit Patel, Joint Replacement Surgeon, Unity Hospital, Gujarat. Welcome, Dr. Patel. Thank you for
Thank
joining
you.
us.
Thank you.
We have Dr. Samir Shah, Bone and Joint Specialist, Orthopedic Surgeon, Vinayak Hospital, Gujarat. Thank you for
Thank
joining,
you.
Dr. Samir. We have Dr. Mukesh Shah, practicing consultant, orthopedic surgeon, Aalok Orthocare, Ahmedabad. Thank you for joining, sir. And we would also be joined in a while by Dr. Kavsar Petrolwala, who's the consultant orthopedic surgeon, Saifee Hospital, uh, Darpan Cinema Road, Gujarat. So, we'll just start with the questions and we'll have Dr. Petrolwala join us in a while. Uh, okay, so without further ado, let's move on to the questions. My first question is to Dr. Amit Patel. Sir, can you please provide us an overview of the different types of arthritis and their prevalence in India?
Regarding different types of arthritis, there are two major types. One is inflammatory, the other one is non-inflammatory. So the non-inflammatory one is the most common thing what we see is age-related osteoarthritis, which usually in males comes after 55 years and in females usually comes after 45 years of age. That is the most prevalent. Coming to the inflammatory types, we have again seropositive arthritis, seronegative arthritis. So there is a whole big spectrum in that. Rheumatoid arthritis, ankylosing spondylitis, we go for SLE, we go for psoriatic arthritis. Then there is another type which comes again under non-inflammatory arthritis is Charcot's. That is also again non-inflammatory, but it has a neurogenic component. So the broad classification is primary and secondary. So primary is there is no cause other than age. Coming to secondary, it has a cause. So cause is it can be rheumatoid, it can be psoriatic arthritis, it can be gouty arthritis. So that comes under secondary arthritis. Coming to the incidence, 180 million people in India currently are suffering with some form of arthritis. Thank you.
Thank you so much, Dr. Patel, on that answer. My next question is to Dr. Mukesh Shah. Sir, if you could please tell us some common symptoms of arthritis and what are some key risk factors that are associated with this condition?
Yeah, the arthritis is one of the most common condition at the moment in orthopedic practice. The commonest symptoms are pain in and around the joint, and patient usually comes with discomfort in walking. There are swelling of the joints, and in advanced cases, you also get the deformities of the joint. They have got usually the difficulty of their daily activities, and the usual risk factors are the obesity, abuse of the joint, like people running on a tar roads, and then a lot of sitting on cross-leg positions, patient having diabetes, having previous injuries. These are all risk factors for the patients. Rheumatoid arthritis, gouty arthritis, as Samir said, the psoriatic. These are also the predisposing factors for the development of secondary arthritis.
Right, sir. Thank you so much. My next question is to Dr. Samir. Sir, if you could tell us how does early diagnosis impact the overall treatment outcomes for individuals with arthritis?
Early treatment, early diagnosis will help for the longevity of the joint. And here we are primarily discussing the primary, as Dr. Amit said, the primary osteoarthritis, which is very commonly seen in India because of our sedentary lifestyle, squatting, sitting cross-legged, so that our knees they degenerate very fast. That is why we see total knee replacements in India in a quite a good number. So early detection, we can ask them accordingly to change their lifestyle, their seating habits, regular exercises, weight reduction. So early diagnosis will always help them so that we can delay the progression of osteoarthritis. Osteoarthritis is a progressive disease. Nobody can prevent it. But if we can guide them properly during the early stages of osteoarthritis, we can save them from future surgeries. So early diagnosis is very important.
Right. Thank you so much, sir. My next question is again to Dr. Amit. Could you share some effective strategies for managing arthritis, including both medical and lifestyle approaches?
Coming to, there are certain modifiable factors uh, in arthritis, such as weight. So first thing, what I would suggest is if the patient is obese, if patient has a high BMI, I would advise to lower the BMI so that the weight which is put up on the knees is on the lesser side. Second thing, dietary habits. Avoid saturated foods. Take food which is rich in calcium, vitamin D. Third, go for regular exercise. Go for a regular walk. Improve your quadriceps power. Third, if the arthritis has set in, regular physiotherapy would definitely help. Uh, I would not suggest a continuous course of medicine, as in painkillers, for a longer time because it itself has a lot of hazards associated with the long-term pain management therapy. And newer molecules have come which improves the bone calcium, like teriparatide or a denosumab injection, which improves the overall bone health of the patient. So the patient can live pain free for a longer period of while, unless a time comes when surgery is the only option. So that is what I would advise.
Right. Thank you so much, sir. My next question is again to Dr. Mukesh. Sir, are there any recent advancement or innovative treatments in arthritis management that have come up that you would recommend to our audience?
Yeah, recent advances में in medications हम लोग patients, there are a lot of molecules, as Dr. Amit also said. We can correct the osteoporosis. Then there are good the collagen 2 types drugs which are supposed to have the cartilage regenerating kind of capacities. And as far as the certain things, operative line of treatment in recent advances are like robotic surgeries and navigation surgeries. And nowadays there are 3D surgeries where there you make the pre-operative design of the joint, and that is the recent advances in the knee surgeries. In arthritis, there are a few things where we can give some lubricants to the in the joints. Like when we give oral drugs, we give the injectables in the joint, like Senvix, lack of molecule, which is supposed to give rise to good synovial fluid, and then they are cartilage protective drugs that we can do in the recent things. Yeah.
Right. Thank you so much. I think it could help a lot of people who are watching this. So, my next question is to Dr. Samir. So, what coping strategy would you recommend for individuals to effectively manage arthritis in their daily lives?
In the daily routine, I will always recommend to do regular knee exercise as Dr. Amit told, and try to control their weight. See, overweight always loads the cartilage. If you calculate statistically, 1 kg weight increases loading of the knee to 4 to 5 folds. So weight reduction, regular exercises, and I would recommend them walking. Walking is a very good exercise, and definitely all reduce weight or to avoid all oily foods, since Gujarati food is full of oil. So try to avoid. You can eat, but not as a routine. Occasionally you can always eat. So regular exercise, weight control, walking will definitely help in their routine life, and that would control their pain, because osteoarthritis is the main cause of pain in knee in primary cases.
Right. Thank you so
Can
much,
I
sir.
add
Yeah, yeah,
something?
please. Yeah,
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 I
please,
think
please.
our patients are having a lot of jumping activities like skipping. The skipping, those patients are doing skipping and walking on a tar roads. Those are the things, and we can advocate them for swimming. Along with that, Samir bhai said, we can advocate them for swimming. Is a very good exercise along with walking. Just thanks for allowing me to
Right,
add.
sir. Sure. So my next question is to you, Oli. Could you discuss the support systems and resources that are available to help individuals with arthritis, and how can they lead, fulfilling lives?
Support systems are very simple. We can advocate patients to maintain their weight by controlling their loading to the joints. Regular physiotherapy, as I said, swimming, walking, brisk walking is a very good things. They should avoid stair climbing, and what are all these things we are talking about the knee arthritis. But if you come to the hip arthritis, we have to nowadays post COVID we see a lot of patients of AVM leading to the secondary arthritis. So we would suggest them to avoid steroids as far as possible and avoid alcohol. Alcohol is one of the very common cause of AVN, which leads to the hip arthritis. These are quite common things. They should use knee support for walking, especially those who have got minor symptoms. They should support the knee in walking while doing the brisk walking.
Right, sir. Thank you. My next question to Dr. Amit. So, what are the notable regional variations in arthritis prevalence in India, and how do you think they impact healthcare delivery?
Regarding variation, I think overall, when we go to rural places, because of the overuse of the joint, people working in farmlands which are like very uneven, where there is lack of basic health system, the diagnosis is always a delayed thing. So whenever patient from rural place comes to us, the joint is already gone. It is already a bone to bone disease. So rather than going for any surgery which could have saved his joint, such as a height level osteotomy. So in urban population, the incidence of early arthritis ending up in a unicondylar knee or a high tibal osteotomy is much more than from a rural person. When the person from rural area comes, it is already a joint to joint. It's bone to bone disease. So it ends up in a total knee replacement. So unhealthy lifestyle, lack of education, lack of health services is what we see right now in coming to the geographical variation in osteoarthritis. There are several surveys which have been conducted in which it says people in Delhi, which says people in Delhi, Mumbai, and people in Bangalore suffer. People in Mumbai suffer more than people in Bangalore. So, but these are I don't know exactly how these surveys were conducted. These surveys were regarding osteoarthritis or was regarding overall arthritis. So, but unhealthy lifestyle comes to the core when it comes to primary osteoarthritis. So this is the variation what we see. And in females, it is always more
Right.
and at much.
I think there's some network issue with Dr. Amit. So we'll move on to Dr. Samir. So what are, adding on to what Dr. Amit was saying, what do you think are the specific challenges or barriers that exist in certain regions when it comes to providing quality arthritis care?
See, Dr. Amit rightly pointed out that our tradition to sit cross-legged and squatting, especially in rural areas, we see more and more people having knee pains. So it is not that every knee pain requires knee replacement. It's not like that. But early diagnosis. So we should educate our graduates, medical graduates who are working in periphery, to diagnose them early, to treat them properly. So to educate the medical persons working in the periphery will definitely improve the arthritic care. And again, regarding our in Gujarat, I see like Dr. Mukesh also will be seeing many patients with knee pains, osteoarthritis in the daily OPDs. We see more and more number of arthritis, young arthritis now. I would label it as a young arthritis. See, like I can many times see X-ray of a 54-year-old male look as if he is 65 years old. So
Yes.
early arthritis. That is one of the reason which I see is obesity, our food habits. So we have to change our food habits. Again, rural areas, we have to educate them. Education programs not only in cities, but also in rural areas should be there, should be developed so that awareness among the patients also increases, so they can come for the management little early. Because many times I see people coming from rural areas with very advanced arthritic, severe arthritic changes in the knee, and their first requirement when they come is sitting cross leg and high sitting, which it totally will be very difficult to provide them that type of movements. So we have to improve our rural healthcare schemes.
Right, sir. Thank you so much. Moving to Dr. Mukesh. Yeah, please, sir. Please go ahead. You were saying something, Dr. Amit?
No, no, no. It's fine.
Oh, okay. So, Dr. Mukesh, how can healthcare providers and communities work together to improve arthritis care at the district level? If you could elaborate on that.
Yeah, it's the most important thing is the awareness of the people. There's Dr. Samir also said in rural areas, people are not aware about this type of facilities and this type of treatments available. So the first thing is they take it very lightly. So awareness programs regarding the early diagnosis of this type of conditions is very important. That can be done by the awareness programs, seminars, and some diagnostic camps you can do. There are a lot of NGOs and government people, they do from government hospitals. They go to the rural areas and they make people aware about their conditions so that their arthritis is diagnosed earlier. Uh, don't, as Dr. Amit used to say, before they go to bone disease, they are diagnosed early in a stage of synovitis or in the inflammatory stage, where you can treat them in a very simple conservative methods like medications, physiotherapy, life modifications things. So these are the things that can be done at the district level to make people aware about their conditions.
Right, sir. Thank you. And adding on to that question to Dr. Samir, sir, are there any specific case studies or initiatives that you can share that have made a positive impact in specific districts or regions in your, practice and in your experience?
Recently, that is, I'm talking 1 month back, we started one program, How to Save Your Knee, for general population in our regional Gujarati language, and we taught them how the arthritis develops, what are the causative factors, how to prevent them, and second thing is once you get it, how to delay the progress. See, certain things we cannot delay, but how to delay that progression of the osteoarthritis, I think is very important, especially among the non-medical persons. They say that arthritis is incurable. Agreed, it is incurable, but you can treat them. And first thing is prevention is always better than cure. But in osteoarthritis, you cannot prevent it because you cannot control your age, and it's a part and parcel. Degenerative arthritis is a part and parcel of our life, and you cannot prevent it. But we can always delay the progression. And it is not that only one thing is there in osteoarthritis, that is total knee replacement. If we can diagnose them and if they have symptoms, there are now knee preserving surgeries available here, and people are now, there is an awareness among them, like it's a knee preserving surgery, how to save your natural knee. Because knee replacement is you put something artificial in the knee joint, but always you can preserve your knee. There are surgeries now available, people have started doing it, and probably in next 10 years the awareness will increase, and our group is trying to propagate this type of surgeries.
Right, sir. Thank you so
They can
much.
squat, they can sit cross-legged, and anytime what is natural and artificial you cannot compare.
Right, true. So, yeah, Dr. Mukesh wants to add something.
Yeah, we are just talking about only degenerative arthritis. In awareness programs, I think we should also discuss about the early diagnosis of rheumatoid arthritis and gouty arthritis. Nowadays, this is very common. So, the routine laboratory testing, simple tests like a uric acid and the blood counts added with a rheumatoid factor test, the patients are diagnosed in rheumatoid arthritis very early, and they, again, as Dr. Samir said, they are not curable, but you can make them to stand still and prevent deformities, so that they would end up in replacement surgeries in a longer duration. Otherwise, these rheumatoid people, they get severe arthritis within 40s of the age. So it will make them aware about these other non-degenerative conditions. Also, we can prevent this type of diseases.
Right, sir. Thank you so much for adding that. My next question is to Dr. Amit. Sir, in your experience, what collaborative efforts or partnership have proven effective in combating arthritis in India?
First thing is government declaring today as the World Arthritis Day. That is one of the initiatives. The second is the camps which are conducted by the social groups in the societies, where we go and educate the people in society how to prevent arthritis. That is one of the collaborative efforts from our side. Second, social media is a very strong medium these days. Any platform you see on Insta where results of surgery after osteoarthritis, doctors publish their results on social media. There are many videos on social media which educate regarding the diet, regarding the healthy lifestyle to be followed, regarding osteoarthritis. So this is going to be a collaborative effort from the doctors and the government, both.
Right, Dr. Mukesh, please.
I think, Dr. Amit, we can also add to the NGOs like Rotary Club, Lions Clubs, and
Yes.
pharmaceuticals like what we are doing today, Pfizer. This is what we are putting to FB and the YouTubes, that we are with a lot of people. This media is such a big thing that you can spread the message to lot many millions of people in a shorter time. That's what we are doing today. So again, this is one of the collaborative efforts by not only government with the NGO also, and along with the doctors, that they know their condition quite fast and that can be controlled quite easily and in a very early stages.
Yes, sir. My next question, you've already answered that. Are there any organizations, both government or non-government, that are leading the way in raising awareness, providing support for arthritis patients? If you would like to add
Yeah,
something
yeah.
to what you're saying.
To add
Yeah.
on, I think NGOs, Rotary Club, Lion Club, okay, that is okay. But I think the initiative should be taken by the pharma divisions also regarding the awareness program. Because if you see, there will be hundreds of video on YouTube for knee replacement surgeries, but you hardly will see a video of knee preserving surgery.
Yes.
So the industry is driven towards knee replacement, that is knee sacrificing. According to me, it is a knee sacrificing surgery. And in India, our requirement, our socio-economic conditions, our rural requirement is squatting, sitting cross-legged, and long-term results. The results, the knee should work for at least 75 to 80 years. Now we see the lifestyles have changed. People live for 90 years, 85 years. So for knee preserving surgery, there is no H bar.
Right.
Initially, it was told that after 55 you should go for knee replacement. But now, if you can diagnose early, if you can convince the patient for knee preserving surgery, and if you can do it, results they are gratifying. The I will quote my mother. She is 78, 79 years old. She has undergone knee preserving surgery at the age of 79, and now she is 87.
That's
So age
great. Yeah.
no bar.
Right.
Only thing is you have to have that, doctors should have that aptitude to preserve the knee.
Absolutely, sir. Yeah. Dr. Mukesh, please.
Yes, I would add to Dr. Samir. Uh, we have also got many cartilage developing, the other cartilage preserving surgeries like when you are diagnosing early the grade 3 meniscus tear or chondromalacia patella, osteochondritis dissecans, there is a cartilage loss. Depending on the depending on the amount of cartilage loss, there are different surgeries. We cannot discuss it right now on that, but there are different. Simple, when there is a less than say 1 centimeter or other 5 to 7 millimeter cartilage loss, you can simple do the abrasioplasty by doing simple microfractures. When it is beyond that, you do the mosaicplasty, and recent advances are the ACI, that is autologous cartilage implantation, where you grow the cartilage in the laboratory and then again put it back in the cartilage. So many young patients, if they are done this cartilage replacing surgery, they are able to withdraw their bigger surgery like replacement for more than 20, 20, 30 years. So we should be also make the people aware of this cartilage surgery, what Dr. Samir also said. So they should know that the knee replacement is not the only solution to the arthritis. If they know what is their problem, it is not the damage to the cartilage to much extent, and the cartilage can be regenerated. Then no doubt those are little expensive surgery, but it is better to have a natural cartilage joint rather than artificial joint.
To add
Absolutely,
on,
sir. Thank you.
to,
Yeah.
to add on with Dr. Mukesh, what he has said, like cartilage. I had been to Japan for twice in two different centers, one in Yokohama and one with Koriyama. And Dr. Mukesh must be heard the name of TCVO, that is tibial condylar valgus osteotomy, which
Yes.
we got trained there in Koriyama for 2 weeks, and we are practicing, me and my colleagues, in my city. And it is there is the results are gratifying. Only thing is the surgeon should have an aptitude to preserve the joint. So awareness should not only be only from the patient side. Awareness has to be from the medical side also.
True.
Because
Yes, sir.
if you survey 100 patients, hardly 10% or 5% will be knowing that knee preserving surgeries can also be done.
Right. So true, sir. So true. Uh, that was, I think, a brilliant elaboration of this answer. My next question would be to Dr. Mukesh. Sir, how does arthritis affect vulnerable populations such as the elderly or those with limited access to healthcare resources? I mean, how is it, worse for them, if I could say so?
Yeah, vulnerable people are the definitely elderly people, especially when they are in a obese status. They are diabetic. They who got previously affected by gouty or rheumatoid arthritis. They are the vulnerable people for this type of arthritis condition. So again, as we discussed, the awareness of the disease will solve the problems. I think so. And uh, once the diagnoses are done, there are a lot of government schemes also which are helping. But early diagnosis and prevention, our total main aim of today's talk is prevention and knee preservation rather than talking about the replacement.
Right, right, sir. So, adding on to it, Dr. Amit, are there any specialized programs or initiative in place to address the unique needs of our population?
As of now, from the government, there is something called as Ayushman Yojana,
Right,
where only the surgical part of the arthritis is addressed. But soon, government is going to come out with a medical management also, which would cover the medical management of the osteoarthritis. So we'll wait for that to come. That would be the biggest thing coming from the government if medical management of osteoarthritis is included in Ayushman Yojana.
right. Yes, Dr.
Amit,
Mukesh, please.
yeah, Amit bhai. In a semi or rather less operative conditions, Ayushman is also covering like if you diagnose their meniscus and cartilage
Yes.
problems earlier, they are
So
also
surgical,
covered in Ayushman.
yes.
Ayushman
So
use.
surgical part
Yeah,
is covered.
yeah.
Surgical part is covered,
Not
but
only
the
medical, I
medical,
agree. Yeah.
yes, yes,
Yes,
yes.
yeah. But
Because
they
the
should, I think,
surgical,
we should, yeah, we should take their notice to their
yes,
notice that the conservative treatment will not only save the money of the government treasury, but
in the
also the
long
needs
run,
of the
yes,
people.
yes,
Yeah, it's a very nice thing. Yeah.
yes.
Thank you.
More weightage should
Yeah,
be given. If you see the Ayushman Yojana right now, if you observe, 99% work is knee replacement.
Yes.
Yes,
I have never heard that in Ayushman Yojana one has undergone knee sparing, knee saving surgery. So it
because the
is a
amount,
basically a industry driven surgery.
yes.
So that is why awareness has to be from both the sides, from the government
Yes.
side also.
So
It is not one sided.
I would like to interrupt. If the amount which is given by the government is at par with the knee replacement, definitely the numbers for knee sparing would increase.
True.
The
right,
amount the amount given to the surgeon in knee sparing should be double than TKR. Then and then
Yes,
only it will change.
yes,
Otherwise, it
yes.
cannot change. Because if you see
True.
the replacement and preserving the osteosynthesis and replacement has more money. Osteosynthesis, which is preserving in hip fracture, has less money. So people what do? They get more money, so they do more. In fact, any surgery which preserves the natural joint should have more money and should be more fruitful to the patient. But the scenario is reverse because it
right.
is an industry driven. Knee replacement is an industry driven surgery. The propagation is knee replacement and knee replacement, and that is why it is so popular. What you
Right.
hear is robotic computer navigation. Ultimately it is knee replacement.
Yeah. Yes.
See, robotic is not that it is a knee preserving surgery. Robotic surgery itself is a knee replacement surgery.
Right.
એટલે ચોકઠું પહેરવા જેવું છે. ચોકઠું તમે કેવી રીતે બનાવો છો? રોબોટ બનાવે છે, માણસ બનાવે છે. But it is ultimately it is a denture. Denture is a denture, and if you preserve the tooth, nothing like it. So it is same true with any joint. I am not talking of only knee. I am talking of hip also.
Right.
Thank you.
Adding on to what you were saying about prevention and preservation. So, can arthritis be prevented? Are there any preventive measures that individuals can take to reduce their risk of developing arthritis?
See, what
Dr.
we are
Samir.
talking is primary osteoarthritis. We are not talking of rheumatoid arthritis. We are not talking of secondary osteoarthritis. What we are
Right.
talking is primary osteoarthritis. The arthritic changes start in our knees when we are in 40s, but they are not symptomatic. Occasionally we get knee pain, but as our age progresses, the knee pain starts once we squat, once we sit cross-legged. So during in our 50s, our lifestyle should be such that we should be active, because for cartilage, activity is very very important. If you have a sedentary lifestyle, cartilage will degenerate very fast. If you are obese, cartilage will degenerate very fast. If your activities involves constant climbing the staircase and coming down, climbing the stair, it is going to degenerate very fast. So we have to take care when we are in 50s, so that, and it is not preventable. Arthritis is not preventable. It is a part and parcel of our aging process. So it is not preventable. First and foremost, only thing is we can decrease the progression, the fast progression of the disease. Control of diabetes, our food habits. લોકો કહે છે ઘી ખાવાનું કેમ ખાવાનું? Why we should eat ghee? So that it can lubricate the joint. No ghee enters into our joint. It's a wrong notion. And then they put on weight. During pregnancy, the post pregnancy, why the weight increases by 10 kg, 15 kg? Because they go on eating and there is no activity. So what happens? You put on fat. So
Right.
activity is the most important stimulus for the cartilage. And
Right.
regarding knee preserving, I've already talked that there are surgeries available.
Right.
Our group is working hard on knee preserving surgery. But since we don't get support from the industry, it is not propagated properly. But next 10 years, I will tell you, it is the time will come when people will be aware that you can preserve your knee. Thank you.
Right, sir. Thank you so much, sir. Dr. Mukesh, are there any ongoing public health initiatives that are focused on arthritis awareness and prevention?
Uh, I would say nothing very specific, but they are now the government is, as Dr. Samir said, they are now going on to the preventive measures and make the government schemes also available for preventive and preventing knee arthritis. So these are the things, and along with them, you have lifestyle modifications awareness programs, and where you avoid injuries to the knee, which leads to the secondary arthritis. The ongoing programs are nothing very specific in our country actually, but I think we should advocate them so that the arthritis is prevented. Not a lot of programs are going, as far as I know. If one of my two colleagues are in some knowledge, they can highlight them. Samir.
Nothing as such
Sir,
right now.
I will
Yeah.
add on to this. I will add on to this. You see many hoardings in the city for knee replacement, that our hospital robotic surgery, this તમને ઘૂંટણનો દુખાવો આવો અમારી હોસ્પિટલમાં ને ઘૂંટણ નવો નખાવો. Are there any hoardings regarding knee preserving?
Exactly.
So our NGOs or our pharma divisions should take up this issue, so that, see, knee replacement is hammered in the people's mind.
Right.
So we
The right.
have to make them aware. Awareness is the most important aspect, because if you don't know, people will never know. You don't see any advertisement for knee preserving. Have you heard for knee preserving? No.
No.
But you will hear 10 times in a day regarding knee replacement surgery, that we get knee replacement. Our staff is very cordial. We have 3D. See, but nothing regarding knee preserving. There is nothing like natural knee. There is nothing
Right.
like natural knee replacement. It is artificial, artificial, and artificial. Thank you.
But after
Right.
a certain point, when there is severe virus, there is unbearable pain, and the patient is not amenable for a knee conserving surgery, the total knee replacement stands true. Coming to the pain part, patient if the patient is coming to the hospital, he does not want pain to be there after the treatment. So the easy way out for the doctor and for the patient both is a replacement. I understand that natural knee cannot be substituted by any form of replacement, but it is not only the doctors who advertise, it is always the demand from the patient. They want to walk straight, they want to walk pain free. So it is not always a one side thing, it comes from
No,
both
it
the
is.
sides.
I don't debate. I don't say that knee replacement is bad. No, certain knees require knee replacement, but the
Yes,
numbers are not matching.
yes,
I
I
am
think,
talking of numbers.
yeah,
If my knee gets arthritic, I will like to preserve
same with
straight.
me, same
Okay.
with me.
Huh. But if you can make them aware that you can do this preserving surgery and you can save your knee, like I will ask you a straight question for knee replacement. If you do a knee replacement and if a patient has post-operative pain, infection, what are the options available to us?
Nothing much, nothing much.
So it is like
Go
Hero
relax.
Honda ad. Open it, feel it, forget it. Shut it and forget it. But in knee preserving surgery, there is always a second option that if after 10 years and 15 years, if your knee gets arthritic and if your pain worsens, you can always do a knee replacement. So second option is always available. But after TKR, there is no second option, according to me, my
Yes,
knowledge.
yes. But still prefer patients. If you tell the patients that it may not relieve your pain, the patient himself withdraws from the surgery for knee conservation. He says, if 10 years after 10 years I have to go for a knee replacement, I might as well wait for further 5 years and then go for a knee replacement. Do it right first time. एक ही बार सर्जरी करेंगे.
Because our psychology, we have developed a psychology of one day. We have
Yes,
never developed a psychology of total of test match.
yes,
We
that is the
want
problem.
everything instant. But if you
Yes,
tell them that if this knee goes wrong, I will not be able to help you, then he will
there is a
rethink.
system of guarantee. બીજો ડોક્ટર guarantee આપે છે.
I think we are a little off track.
Yeah, we are little off track.
Yeah, I think I would
No,
like to.
because sir, we are
Yes,
little off track. The reason is only one
yes,
that
yes.
see prevention, preservation is prevention, according to
Yes,
me.
Yes.
yes.
Preservation is prevention.
But majority of the patients who
Uh,
come to our OPD, uh, they are almost out of the spectrum. Most of the patients are out of the spectrum. Hardly one patient in 10 patients would be eligible candidate for a knee conservative surgery. Rest 9 would definitely require a bone to bone.
Sorry, will require what?
It will require a TKR. Out of, if you are running a arthritis OPD, only one patient would match the criteria for a knee conservative surgery. If we
It
say for an
depends on your
HPO,
criteria.
yes,
Please, Dr. Mukesh, go ahead.
I think I will put it this way. We are today on arthritis talk, so it's a perfectly right thing what Dr. Samir says. But most important thing is number one is there are not so many complications of infection in TKR nowadays when we are doing with such an experience and class 100 theaters. That is one point I wanted to suggest. Second thing, there should be a definite demarcation of the procedure by a surgeon. Then yes, here you stand for a conservative treatment, absolutely non-operative. Here is a patient where you need a semi-conservative treatment like high tibial osteotomy or arthroscopic cartilage surgeries, something like that. Along with that, some intra-articular injection or whatever, and with the physiotherapy. And there are a group of people, as Dr. Amit said, that there are a group of people, they are like in 60s, for example, and they are not able to walk for about more than 100, 200 steps. They are not able to climb the stairs. They are absolutely dependent on their children. So those are the people who need replacement. So we have, as a surgeon, it is our duty to make the patient realize that where do you stand. You need absolute conservative treatment, you need axis correction surgeries or arthroscopic surgery, or you need a TK. That's what my stand is. That we should be able to tell the patient, yes, here, suppose I am 68. So if I am not able to perform my normal surgeries, I am not able to climb my OT stairs, and I go to my orthopedic surgeon, Sir Mukesh, you better you get your next 10 years or 15 years, you'll be able to operate and do the things. So that's how the things should go. That's what I take the things.
It has to be a patient-specific approach. What the
Yes,
patient
yes.
requires.
We should have three different things, Yeah. So
Right, sir.
TKR is not a surgery that patient should not be saying, no, nahi aap yahi karo, not like that. If you are in a stage, आपकी routine activities are also suffered. You have got a bone-to-bone disease. You have got a virus more than 12, 13 degree of virus. You got, then you have to advocate them the right thing, and that is take care.
Right, sir. Thank you so much. I hope this program is able to help people, get a little bit more aware of the available options. So moving on, my next question is to Dr. Amit. Are there any technological advancements or digital tools that are proving beneficial for the management and treatment of arthritis?
The strongest media which I see right now is social media.
Right.
That is the only thing which is there right now. Be it be for, there are many diet related videos available. Watch regarding weight reduction is an epidemic. It's a big industry right now. Weight reduction.
Right.
You see many videos regarding the diet charts. If you want to lose weight, eat this, eat that. So I think that is a positive way to reduce. People might get to that, reduce their weight, improve their lifestyles. Maybe that is I think the best option which technology now can do it. The other things, as Dr. Samir said, there should be hoardings from on the road while people drive in their cars, and they can have an alternative approach to their early osteoarthritis. So this is what technology can do, I think, now. That's the strongest medium.
Right. So anything you would like to add, Dr. Samir, Dr. Mukesh, on
Nice.
the recent technological advancements, digital tools that can prove beneficial in management and treatment of arthritis?
So not really in conservative and semi-operative. There are a lot of innovations going on in the replacement surgery. So we will not discuss that right now here. Innovations are there, definitely innovation, but not for the in the conservative treatment. As I mentioned, there are a lot of cartilage protective medications available. Few surgeons do not believe in that. I do believe. I have got a lot of patients on my cartilage protective drugs, and they do well. They have that knee pain relief more than 5 to 10 years. So these are lot of good drugs are now available. Intra-articular injections are also in a very nice injections are available that patients can pull on every 2 years. If they get injection, then that knee works for another 5, 7 years.
Right. Dr. Samir, anything you'd like to add?
Same that Dr. Mukesh and Dr. Amit pointed out, but
Right.
definitely awareness like by social media is important nowadays. Social media is very powerful. WhatsApp and Instagram and they
Right.
are very powerful tools to propagate the message. I think we should take up that thing in the next planning has to be like that.
Right,
And
sir.
prevention, and try to preserve what is natural.
Right, sir.
And if need arises, yeah, the tool is always there if need arises.
Robot is waiting.
Absolutely. So we have some questions from our audience. I'll open it to all three of you, whoever would like to answer. So, at what point the person suffering from arthritis would need surgery for knee replacement? If any of you would like to take this question. Sure, please, Dr. Mukesh.
I think I already mentioned it. There are a group of people where they have already tried conservative treatment of physiotherapy, medications, life modifications, and all semi-conservative treatment, and they are suffering for more than years. They are not able to walk for more than 200, 300 steps. They are not able to climb the stairs. Their daily activities are suffered. The surgeons like me, if I'm not able to do my surgeries, if I'm not able to attend my clinic more than an hour or two, where I'm supposed to do it for 5 hours, then those are the people where by X-ray it is proved that they have got a bone-to-bone disease. There is a considerable virus, and the routine range of movements are even are very painful. Those are the people who need surgery. Yes.
Okay, sir. Yeah, please,
On,
Dr. Amit.
on clinical examination, if the patient is started having a varus thrust gait, and if the patient is having a back pain associated with it, that is the
Right,
point when you suggest alignment correction surgery. That alignment correction can be with a total knee replacement or with a osteotomy. That is a knee conserving surgery. But the
right,
mechanical alignment should be corrected to avoid that thrust gait, or else the patient will have a spine surgery at a later date.
right.
In
Yeah,
the in
please.
the in the axis correction surgeries, we have to be careful that they do not have flexion deformities and their ligaments, especially
Should not
ACL,
be
is
that.
good.
Yes.
Yeah, and the varus is not more than 12, 13 degree or 15 degree, I would say. Only those are the people. There are certain osteotomy surgeons, they do surgery even in 15, 17 degree of varus. There are 15, 20 degree of deformity of the knee. For layman, I think this is difficult to understand. लेकिन मैं हिंदी में समझाऊं तो जब जॉइंट आपका बेडोल हो गया है 15, 20, 25 डिग्री बेंड हो गया है आपके लिगामेंट्स अंदर के नॉर्मल नहीं है तो आपकी एक करेक्टिव ऑस्टियोटोमी ओनली काम नहीं करने वाली देन यू
Yes.
आर अ पर्सन और कैंडिडेट फॉर रिप्लेसमेंट
Sir,
Okay, sir.
sir, may I interrupt you?
यस यस
Sir, as you have rightly pointed out, that those are not the good candidates for high tibial osteotomy. High tibial osteotomy surgery is correction of the mechanical axis. High tibial osteotomy only corrects the mechanical axis. But the surgery which we are propagating, our group is propagating, is TCVO, that is tibial condylar valgus osteotomy, from a Japanese group, and they are doing it since last 40 years. They have follow-up of 30 to 35 years, and it not only corrects the alignment, it provides stability and congruity to joint, which is very, very important for the cartilage to regenerate. And they have documented that post surgery the cartilage regenerates. To give an example, I have a patient. I have a video which, unfortunately, I cannot share you. The patient at the age of 68, he had varus knee, osteoarthritis, medial joint, lateral joint was good, medial laxity of the MCL, the medial ligament. So that is why if you see many patients of arthritis, they have beddling gait. They cannot walk straight because the ligaments are lax. He was I had offered him TCVO. He opted for it. He is now 72 years old. He can walk daily 4 to 5 kilometers. Initially he was not able to walk till half an kilometer, and he is off the analgesics. not a single painkiller at the age of 72 he is taking. So what sir is talking is high tibial osteotomy, which is only successful when there is mild varus. But when there is moderate to severe varus, that is varus is bending of the knee, is if it is more, high tibial osteotomy doesn't work.
Right. Please, Dr. Mukesh.
There is a question from Ashok Shah. He's asking
Yes.
how the lubricants are able to postpone. Yes,
Right.
you have to know that your joint is in a moderate condition and not a severe condition like Dr. Samir said, Amit said, the bone-to-bone disease. So it should be a moderate condition of osteoarthritis where the pain factor is synovitis and not you are in a bone-to-bone condition. Yes, lubricants do help. I've got number of patients where I've given lubricants and they do well for 2 years, 1.5 to 2 years, sometimes 2.5 years. And if you can postpone your TKR surgery for maybe 2 to 4 years. Yes, Dr. Ashok. Hope I
Thank
answered
you
it.
so much.
Yeah.
Right. So we have one more question from Senthil Kumar, if somebody would like to take this question. The role of collagen in arthritis, if there is any.
I'm sorry, I didn't get the question.
Sure, Dr. Mukesh.
Yeah, I think again the same way like lubricants, there are certain good collagens uh, where again in a early to moderate osteoarthritis they do help. They do help, provided all other things are not bad, like cartilage and the bone. It doesn't have bone-to-bone disease. They are good for early and some part of moderate osteoarthritis. Yes.
Okay, sir. Thank you so much for answering that question. Sir, I'd just like to take all of your closing remarks as we draw uh, to conclude this session. Any advice that you'd like to give our audience?
Healthy
Yeah.
lifestyle and exercise.
Yes. You should be aware of your condition, as I said. Where do you stand? Are you in a conservatory, as Dr. Samir said? There are a lot of needs which you can preserve. Lot of needs. So it's not that TKR is the only solution to the arthritis. That is what the message we like to convey.
Yes.
Yes. So obesity, dietary habits, certain not jumping activities should be avoided, not climbing up and down. All those prevention measures should be taken care. And you take care of your underlying issue, control of your sugar, control of your body weight. These are the very important messages to the people around for today's arthritic day. Yes. And I
Right.
would definitely agree with Dr. Samir that we should definitely concentrate on preservation knee surgery rather than take care. Yes, I entirely agree with Dr. Samir.
Dr. Samir, any
Thank you, sir.
last remarks?
Yes, as I have suggested, prevention is preservation.
Yes,
So, as Dr. Mukesh said, that you have to preserve, you have to educate, change in lifestyles, change in food habits. They are very important, and we should request the pharma companies, the industry-driven companies, that they should also propagate preservation rather than replacement only. Right now, it is one way only. It is not two way. It is only one way. Is knee surgery is knee replacement. If you have pain in knee, the final answer is knee pain. And the awareness is that yeah, you can walk from second day, but how long you can sustain that knee, that artificial knee? Anything which is artificial has a life. Sir, do you agree?
Yes.
yes,
Anything which is artificial as a life, what is natural, and if you preserve the nature, I think it is lifelong. Because I have witnessed the results of knee preserving in Japan, Korea, Sir, that is Professor Teramoto. We have worked with him for 15 days. continuously from morning till evening, and he has shown us the results of 30-35 years. And they have undergone knee preserving surgery at 85 years, 86 years. My oldest patient operated is my mother, who is 79, and recently my auntie, she has also undergone knee preserving surgery. She is 72 because her little joint was good. So if you have only tooth in pain in one tooth, why to replace everything? You cannot have denture for everything. If you can preserve that tooth, I can ask the straight question to you that if only one compartment is arthritic, why to sacrifice the three?
Right, sir.
That is my straight question to all the replacement surgeons. That yeah, answer is there is uni, but it's not that popular.
I would address the patient as as the condition of the knee. It is not like that I don't conserve, but it depends on the patient's
Exactly.
condition and the X-ray of the patient. It depends what is the age of the
Sir,
patient,
I
what does his
I
X-ray.
don't criticize knee replacement surgeons. I respect knee replacement surgeons. I am not against total knee replacement. Please quote me. I am not
Yes,
against knee replacement surgeons. But knee replacement surgeon should be aware that knee can be preserved and accordingly they
yes,
can advise
yes,
True.
to the
yes,
patient. That
definitely.
is my request. But I am
Definitely.
not against any knee replacement surgeons. Agreed. A knee can be replaced. Many knees, I have advised them to my friend that you go there and get your knee replaced because I cannot preserve your knee.
Right.
But it is never vice versa.
We will send you this.
Right. So, on behalf of all these surgeons, all three of us, we thank the audience who have tolerated us for 1 hour, and to the Pfizer company and you, ma'am, for conducting such a nice session. Thank you very much. Thank you.
Thank you so much,
Thank you.
all of you, Dr.
Thank you,
Mukesh,
sir.
Dr. Samir, Dr. Amit. Thank you so much for joining. Thank you. This was a
Right.
very interesting session. Thank you.
Thank you. Yeah.
Thank you.